Hi Tamila.
Hi.
Good to see you.
Good to see you again too.
Welcome back. So I see you have some sensory problems that you've experienced lately. Okay, tell me a little more about this.
So it started maybe a month or two ago. I started to feel some tingling in my feet, my fingers, and my scalp.
Tingling, feet, scalp, and fingers. Both hands or only one?
Both.
Both. And both feet? Okay. The tingling, is that dull? Is it sharp? Do you feel any zaps?
Mostly sharp.
Mostly sharp. And is it pleasant or unpleasant?
Really unpleasant.
Really unpleasant. Okay. Any idea what could have contributed to this onset of symptoms?
I would say it started after I started ice skating.
Ice skating? Ice skating. Okay. And you started this activity at about the same time?
Yeah.
A month ago.
Right after it started.
Okay. Any blurred vision or double vision associated with the symptom?
No.
Any ringing in your ears?
Sometimes.
Ringing in ears. Deep ears. Both ears?
Both.
Both ears. Any pain anywhere else in your body?
No.
No pain. Are you on any new medication?
No.
No new medication. Alright, well, let's take a look at what's going on with you today.
Okay.
So I'm going to perform a neurological assessment of your upper body first, and I'll be looking at your scalp, your face, your chest, your arms, and hands, and then we're gonna take a look at the feet as well.
Sounds good.
Okay. I'm gonna go ahead and sanitize. Are you experiencing any of these symptoms right now?
In my feet.
In your feet? Okay. On a scale of 1 to 10, how would you rate them?
Like 4.5.
A 4.5. All right. So let me just go ahead and just kind of feel your skin first, and just feel the temperature, even temperature. Okay. No excess sweating. Uniform. Any pain when I press on your hand?
No.
Good. Okay. Just getting a baseline. Good. Not noting anything out of the usual. Good. Right, so let's begin with a couple of neurological tests on your scalp.
Okay.
All right. So I have here a device that places a very localized amount of pressure on your skin, and I'm going to poke you with it on a couple of very important points on your body. Keep your eyes closed, and just say yes when you feel it.
Yes.
Good.
Yes.
Good.
Yes.
Good.
Yes.
Good.
Yes.
Good.
Yes.
Good. Good.
Yes.
Good. Okay, now I have here a device that's going to blow a little puff of air. And try to tell me where is it that you're feeling it.
Okay. My nose.
Okay.
Cheek.
Good.
Other cheek. Neck. Neck.
Left or right?
Right. Left.
Good.
Right ear.
Good.
Left ear.
Perfect.
Left palm. Right.
Good. Now I'm going to do the same on one of your fingers. Try to lift the finger up when you're going to feel the puff of air on it.
Okay.
Good. 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 We're going to repeat the test. Good. 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 Alright, let's do the same on this hand. Good. 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 Alright, so you have sensations in your arms and your palms. Next up, we're going to do a test that's called sharp or dull. Please have your palm. This is dull and this is sharp. Keep your eyes closed and tell me which one I'm touching you with.
Dull.
Good.
Sharp.
Good.
Dull.
Good.
Dull.
Good.
Dull. Sharp.
Good.
Sharp.
Good.
Cold.
That was a trick. Very good. Alright. Do you feel this?
Yes.
And this?
Mm-hmm.
And do you feel this?
Mm-hmm.
And this?
Yes.
And this?
Mm-hmm.
And this?
Yes.
And this?
Mm-hmm.
Okay. And do you feel this?
Mm-hmm.
Sharp or dull?
Sharp.
Good.
Sharp. Dull. Dull. Sharp. Sharp.
Good.
Sharp. Dull. Sharp. 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 Dull. Sharp.
Very good. Okay. And now we're going to do a test that's called very sharp and cold. Continue keeping your eyes closed and tell me which one you feel.
Sharp.
Good.
Cold. Sharp. Cold. Sharp. Sharp. Cold. Cold. Sharp.
Good.
Cold. Sharp. Cold. Sharp.
Good.
Sharp. Cold.
Good. Next up, I'm going to inspect your scalp. Is it okay if I unclip your ponytail?
Sure.
Okay. looking for any skin abnormalities of the scalp. Any external signs that may indicate any neurological abnormalities. Move your head that way. So I'm not seeing anything abnormal. I'd like you to lay down, face up to begin with, and I'll take a look at your feet.
Sure.
Okay. I'm first going to explore the top of your legs. Even temperature. No excess sweating. I'm going to check for the pedal dorsal pulse. Alright. I'm going to pull slightly on your toes. Let me know if you feel any tenderness and if the tingling sensations are increasing. Okay. Good. Can you wiggle your toes for me? Good. I'm gonna take a look with my light. Between the toes. Good. No nail clubbing or pinning. Capillary refills within 2 seconds, which is normal. I'm going to go ahead and do a little tapping on your toes and your bones, and I'm going to check for pain. Okay. Tapping on the tibia first. Tibia bone is intact. Checking the talus next. going down the midfoot to the metatarsals. And the phalanges. Which are intact. Good. And finally tapping on your toes. Good. All right. Do you feel this?
Yes.
Good. All right. Do you feel this?
Yes.
Good. And that?
Yes.
Good. And do you feel this? And this? Good. Can you wiggle the toe that I'm touching? Good. 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 Can you tell me if I'm bringing your toes towards your head or towards me?
Head.
Towards your head. Good. Any pain here?
No.
Here? Here? Here?
No.
Good. Can you resist me trying to spread your legs apart? Good. And resist me trying to push your toes towards your head. Good. Now push into my palms. Good. Okay. Next up, I'm going to check your deep perineal nerves. Do you feel this?
Yes.
And this?
Mm-hmm.
Is this sharp or dull?
Sharp.
How about this one?
Sharp.
Good. And I'm also going to check your sural nerve. Do you feel this?
Mm-hmm.
Is this sharp or dull?
Sharp.
Good. Feel this?
Dull.
Good.
Sharp.
Very good. And I'm also going to check your saphenous nerve. Feel this?
Mm-hmm.
And this?
Yes.
And this?
Mm-hmm.
And this? Good. Is this sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Good.
Sharp. Dull. Sharp. Dull.
Good. Okay. Next up, I'd like you to flip face down. Alright, I'm going to begin by just feeling the skin. Okay, even temperature on the plantar region, no excess sweating, uniform distribution. Alright, I'm going to do a visual inspection of your calcaneus bone. Looks normal. The plantar region of both of your feet. Can you wiggle your toes for me? Good. Okay. I'm going to inspect in between the toes. Okay. Checking for mobility. And reflex. Good. Checking in between the toes, your left foot. No hidden melanomas. Okay. Let's check the capillary refills. 2 seconds. Good, quite normal. Alright. I'm going to do a neurological assessment of the plantar region of your feet. And I'm going to start by inspecting the medial plantar nerve. Do you feel this?
Yes.
And this?
Mm-hmm.
Good. Is this sharp or dull?
Sure.
Good.
Sharp.
Good. Next up, I'm going to take a look at the tibial nerve in the calcaneus region. Do you feel this?
Yes.
And this?
Mm-hmm.
Sharp or dull?
Sharp. Sharp. Dull. 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 Sharp.
And do you feel this? And this? Equally on both sides? Good. This and this equally on both sides? Good. Alright, next up I'm going to evaluate the venous nerve. Do you feel this? And this? Sharp or dull? Good. I'm going to cause a vibration and put it on various important points of your feet. I want you to tell me if you first feel the vibration and then when it stops. Feel this?
Yeah.
Good. Stop. Good. Feel this?
Yeah.
Good. Feel this?
Yes. Mm-hmm.
Good. Feel this?
Yeah.
Good. Feel this?
Yeah.
Good. Did it stop? Good. All right. Next up, I'm going to tap on your bones next. And just evaluate the integrity of your bones. Check for any pain, any abnormal triggers or sensations that may arise from a neurological point of view. Do you feel this? How many taps do you feel? Good. You feel this?
Mm-hmm.
How many taps?
4.
4. Good. Count the number of taps again.
2.
Good. And now? And now?
4. 5.
Good. Good. How many taps?
2.
Good. Okay, count the taps. 1, 2, 4. 4. Good. You feel this?
Mm-hmm.
And this?
Yeah.
Good. Feel this?
Yes.
Good.
Yes.
Good. Count the taps.
2. Yeah.
Very good. Is this painful? A little bit. On a scale of 1 to 10. 5. Okay. How about this painful? Okay. So a little bit of sensitivity on your right foot. Have the tingling sensations increased in intensity or decreased while I was doing all of these tests? Increased. And if you were to rate them? Maybe 4. 4. Okay. Do you feel this? Okay. Can you tell me when I'm stopping? Stop. Good. Stop. Good. Stop. Good. Stop. Stop. Good. Stop. Stop. Good. Okay. That's good. Good. Alright, I mean I can come back up now.